One of the commonest questions patients ask is, how do we identify which IVF clinic is good? Part of the problem is there are now hundreds of IVF clinics, literally one in every street, and everyone claims to be the best. How are patients going to make out? And this is a bit of an issue because there's very little regulation in India, very little quality control. Every IVF clinic claims 60% success rates, and it's very hard to know who's telling the truth and who's not. And this is why it's very important that patients need to protect themselves with what I call information therapy. So they're well informed, they know exactly what's going to happen. And the hallmark of a good IVF clinic is that they will provide embryo photos routinely to all their patients. This is documentation because remember, the only tangible product an IVF clinic can produce is embryos. Once we make an embryo and put it back in the uterus, then we have no control whether it's going to implant or not. But if we've created good quality embryos, we have the confidence and we display it by actually giving you photos of those embryos so you can share it with other people. Other doctors can confirm that we've done a good job with treating you. Remember, outcomes after the transfer are uncertain, but the process up till the point of creation of embryos is within our control. And this is why good clinics will routinely give photos, and this is why good patients should insist on getting photos of their embryos from patients. Because this is one way of making sure that you're getting good quality medical care. So you have peace of mind that you didn't leave any stone unturned. The good news is that this is a simple routine process in most good IVF clinics. And that's why it's responsibility on the part of the patient to make sure that they ask the right questions so they get the right answers.